Thank you, Ali. Well, welcome all to another webinar brought to you by the Western New South Wales Primary Health Network. Today's session is My Health Record Policy and Compliance. So I'll be your presenter today. My name is Brenton Jones. I'm the Senior Digital Health Officer at the Western New South Wales PHN. And my colleague, panel member Lisa Bowes, is Digital Health Support Officer. Just some housekeeping before we get started. You're welcome to type in any questions you have in the chat box and we'll address them at the end of the presentation. Everyone is set to mute, so please keep your questions to the chat box. The session is being recorded and will be made available on demand on the Western New South Wales PHN website. Now, if you are viewing the webinar on a shared device, please type each viewer's name into the chat so your attendance is recorded. And I highly encourage too, if you could please complete the evaluation form after the session. I'm sure today's webinar will provoke a lot of questions. It's a big one. Don't feel guilty at all if you have to drop off early. As I said, this will be recorded, so you can always check back in later if you miss something. I'd like to first of all acknowledge that this meeting is acknowledging the people of the Wiradjuri Nation, as I'm sitting in Orange today, not Bathurst. And I'd also like to acknowledge that we work on the traditional lands of many Aboriginal nations across Western New South Wales and pay respect of their connection to land, water, and community. I pay respect to elders past, present, and future, and extend that respect and a warm welcome to First Nations people present today. So our objectives for today's session is to describe core features of My Health Record and recognise how it can help improve access to important health information and enhance coordination of patient care between healthcare teams. Define participation and compliance requirements for implementing and accessing the My Health Record. Outline steps involved to register and implement My Health Record within practice. Identify how to use the key documents within My Health Record to support clinical decision making. So the session today can be best broken down into 3 stages or 3 chapters, if you like, and I'll focus on all 3. However, I will point out that this presentation has been adjusted slightly in certain sections just to fit within the time allocated. But there is obviously a range of obligations for healthcare provider organisations that want to participate with My Health Records. You know, some of these arise prior to registering for My Health Record, and others are ongoing obligations following the registration. And being compliant is as simple as following these 3 essential stages. Now, obviously, many of you attending this session today will be at different stages of My Health Record usage and adoption. Some, your organisation may be right at the very start assessing the role of My Health Record, and so all 3 chapters would be important. But some, if you've been using My Health Record in general practice for some time, this is going to be more about the ongoing participation obligation. So each section will apply in different parts. So the first stage is focusing on the My Health Record obligations that are required prior to registration, establishing a security and access policy, and allocating who the responsible officer, or RO, and organisation maintenance officer, or OMO, will be. Now, it is important that healthcare provider organisations have a My Health Record security and access policy in place prior to registering to participate in the system. And the organisation will be required to declare that they have this in place at the time of registering. Now, the Office of the Australian Information Commissioner, or the OAIC, in collaboration with the agency, has developed a security and access policy template that can be used by healthcare provider organisations in all sectors to develop a policy for their organisation. Now, this policy must cover a range of prescribed matters and must be communicated to, accessible by, and enforced with employees and healthcare providers to whom the organisation supplies services under contract. So let's cover a brief overview of the My Health Record policy requirements as per the legislation. And don't worry, I'm not going to take you through the entire legislative documentation, but what the organisations need to do if they want to register and access My Health Record. And I come across a nice little headline from our friends at the Australian Nursing and Midwifery Federation and the Victoria branch. Nice little article, and it kicked off like this. They say curiosity killed the cat. It can also kill your career. Accessing medical records when you are not authorised to do so is not only inappropriate, it is illegal. Now, just to make this webinar a little bit more engaging, we've got a few quizzes throughout the day. So I'd like you please to participate, and don't worry, all answers are anonymous. Doesn't matter if you've got the answer wrong or not. This is all in good fun. So Ali, if I could get you to launch the very first quiz, please, for today. So the first one is all staff members, regardless of their duties within the organisation, will require access to the My Health Record system. True or false?
Okay, I'll share that now, Brenton. I think
Thanks, Ali.
everyone's in. Just bear with me. I think about 20 answered that. Can you
Very
see
good.
that? Okay, yep.
Very good. So those that said false was correct. So 84%. Congratulations. Those that said true, well, let's have a look at why that might be the case. All right. So not everyone in an organisation, and we're going to talk about the importance of the entire team, their roles and responsibilities in the workflow. Now, here's another little mantra which I think is very important. If you're involved in the care of an individual, then accessing their record and inputting information into that record is essential as part of your duty of care. It's a simple thing to remember. And this is, by the way, almost directly from the legislation itself. Now, the My Health Record is governed by a legislative framework. So think of it wrapped in this cotton wool bud, if you like, all right, that specifies who can access My Health Record and the use of information within the system. The participating organisations and healthcare providers must comply with this legislation. So the My Health Record Acts 2012 and the My Health Records Rule 2016 are the pieces of legislation that outline the obligations for participating organisations. So the My Health Records Act establishes the role and functions of the system operator, and you'll see me refer to the system operator on occasion throughout this, and that is the Australian Digital Health Agency, or ADHA. 2, a registration framework for individuals and entities such as healthcare provider organisations to participate in the system. And 3, a privacy framework, which obviously is aligned to the Privacy Act of 1988, specifying which entities can access and use information in the system, and the penalties that can be imposed on improper use of this information. Okay, so let's just do a little quick dive into the rules. And there are 3 rules, primary rules here, rules 42, 43, and 44. So there is so for rule 42, there is a requirement for organisations to establish a security and access policy of the My Health Record Rule 2016. This also lists the matters that must be covered by the organisation's security and access policy. Rule 43, a copy of your organisation's policy may be requested by the system operator, which is the ADHA. If such a request is made, your organisation would need to provide a copy of the My Health Record Security and Access Policy within 7 days of receiving the request. And Rule 44 covers user account management within the healthcare organisations. This means that organisations need to ensure that IT systems that interact with My Health Record employ reasonable user account management practices, including the capability to have strong passwords and the ability to revoke access from a staff member if required. So these rules are in place to safeguard the use of My Health Record and to give both patients and clinicians confidence that it is secure. So there are further legislative requirements. Now, the security and access policy is a resource that you should actively use and apply. You should also ensure that your security and access policy is kept up to date. So it's preferably annually. This goes beyond good business practice because it is something that the My Health Record legislation requires of your organisation. It also requires you to ensure that that policy is reviewed at least once per year, as I said, as well as when the material changes, if something's new or changes, and risks are identified, more importantly. These could be a change within the system, organisation, or regulation, or factors that might result in unauthorised access, use, or disclosure of information in a record. Now, here's an example. This is just a cut and paste from the security and policy template, which I'll walk you through in a moment. But it must include and address the topics outlined in Rule 42 of the My Health Records rule. Now, there are a range of prescribed matters, and they are how your organisation will authorise, deactivate, or suspend access for staff using the My Health Record. Information on training will be provided to the staff, and the process to identifying who has access and how that will be communicated with the system operator. And more, as you can see here, stated on the template. Okay. Now let's just talk about some key roles and responsibilities. Most of you will be familiar with the two primary roles here. So prior to registering, you need to consider who will be assigned as the responsible officer and the organisation maintenance officer. To define them both, so the responsible officer is the officer who will have authority to act on behalf of the organisation in its dealings with the system operator or the ADHA. This could be the owner of your practice or a group CEO or manager or one of 4 directors, for example, who will perform tasks like initially registering the organisation to participate and then dealing with any significant registration changes. The RO is also responsible for overseeing the organisation's legal compliance. Now, the organisation maintenance officer is a role assigned to those responsible for implementing, responsible for the implementation and compliance monitoring of the My Health Record policy. So an employee of the organisation who is responsible for general day-to-day administrative tasks is often best placed as an OMO. Now, they often have the responsibility of developing and implementing the security and access policy as well as a delegated task, and multiple people can be assigned to this role. That's the benefit of it for job share. And it might be your practice manager, a 2IC, receptionist, as well as the practice manager, that kind of thing. Now, or having a My Health Record champion, in fact, is another good option as well. Now, having multiple OMOs is a great idea to share the tasks relating to this role, so if you can have multiple in-house subject matter experts to assist with. But it's also, this is an old slide now, but I think it's an oldie but a goodie in my view, because on a page, and you should be doing this as a regular activity too within practice, is lay this out with the organizational structure, roles and responsibilities, and think about the workflow here. And under each particular work responsibility workflow, you've got certain aspects of the My Health Record that might apply. Now you can see in orange there, responsible officer, OMO. They can be, those orange badges, if you like, can be assigned to pretty much anyone in the team, depending on the organizational hierarchy. Obviously, we talked about the RO would typically belong with the organization's owner. But then your OMO could be badged, for example, a practice manager could be OMO, a receptionist could be OMO, especially if one of your 2IC receptionists becomes a My Health Record champion for the team. And then you've got your clinical roles on the right, GP and nurse. And let's not forget, of course, making sure that your nurse roles, certain functionality for RNs only, it is different to Aboriginal health worker and that kind of stuff. So having all that mapped out, so it's very, very clear, and then embedding this in job roles and descriptions is extremely empowering and beneficial, especially when it comes to staff induction and training. Now, I will leave this up on the screen just a little bit so you can see the link. This will be made available to everyone later, obviously, but the Office of the Australian Information Commissioner, as I said, the OAIC, in collaboration with the Australian Digital Health Agency, have developed a My Health Record security and access policy template. So you don't have to do all the heavy lifting. It's pretty much a cookie cutter template that you download, and then you can customize it to your own organization's needs. developing your own policy. So this template is also accompanied by an e-learning module on the ADHA website, which walks you through some of the practical steps for developing a policy. Now, for today's session, I'm going to avoid doing a deep dive into this template, all right? But please, if anyone is interested in a webinar dedicated to walking through every page of this template to help you craft one, feel free, put that comment in the evaluation form and we'll take that on notice. But I'm going to go highlight a few from the template, which I think are important elements that get you thinking about why it's so important to have this documented. So for now, I'll just provide a quick overview, making note of some important sections. But it does show you a few screen snips from the template. Now, you can use this as a guide only to adapt for your own organization. So even when using a template, there is no one size fits all. So it's important to ensure that the policy is adequately adapted to suit the need of your organization. Now, like any template, everything you see in the blue in brackets is editable, all right, as a downloadable Word file. And where you need to adapt the content, you can include information that's relevant to an individual organization. The template also has provided some practical examples throughout. However, these are simply there to prompt you to think about procedures that might work for you or processes that you may already have in place in your organization, for example. So where you see choose an item in the body of the text will allow you to use a drop-down menu to select from a range of options. And there's a couple of predefined fields there which help you to complete that and whatever's relevant to you and the team. You can also replace any option with your own if that is more suitable. And don't forget to delete any examples that are not relevant to your organization once you have completed a section. And a good example in this, for example, is supporting patient registration, assisted registration of My Health Record for those that don't have a My Health Record. That's a policy decision that you can make that we either don't actively participate in that or we do. And that's where you could look at reception staff to support that if you decide to do that. Now you'll see reminders about these tips throughout the policy template. And as you can see here, it has a key information section, which is pretty straightforward. And this is where you would put your responsible officer and OMO details. If there has been a change to these roles, which let's face it, in general practice, and it's quite common for staff to come and go, then this is something that you have to update quite regularly. Hence, that's why we say minimum annually that this policy gets updated. And this should be actioned within 20 business days to comply with the Healthcare Identifiers Act 2010. Okay. Now, this part of the policy template is asking you to document how you will communicate user identity to the system operator if requested. So as per Section 74 of the My Health Records Act 2012, organisations need to be able to provide information to the system operator where requested regarding the identity of a person who accessed the My Health Records system. A common example provided here is through the clinical software. Most conformant softwares that connect to My Health Record will have a user log that records who has access and who doesn't, using their login details and their unique healthcare identifier, for example, a HPII. And this is what makes the software compliant. So accessing and using logs and lists or registers throughout your software product is a way that your organization could determine the identity of the individual who accessed My Health Record. The organization should then have a process in place where the RO or OMO communicates user identity to the system operator if required. Now, another element of user access management is having a system in place to collect and record the HPIs of healthcare providers accessing the system. Conformant software have that capability to produce audit logs, as I said, so it's very, very handy. Now, I've highlighted this section only if you share your premises, reception, and IT system with other healthcare providers under contract. This is another unique system which may or may not apply. And of course, you can delete it if it doesn't. But as an example, this would be a GP practice where an allied health professional, their own business, for example, is renting a room and uses the practice's software and computer systems. Now, if you don't provide that, then you should state that in the policy. using the supply drop-down. With regards to both employees and healthcare providers to whom you supply services under contract, you should ensure that you communicate the contents of the policy through training or induction sessions, and you should keep the policy readily accessible so that employees and other healthcare providers can refer to it easily. Now, at this particular point, I'm just going to pause for another quiz. So Ellie, if you could just load up the next one, which will help me lead into the next slide, which I think is going to be quite relevant to a lot of our attendees today in rural and remote sessions. So when computers and devices are used at an external location by organisation staff to access My Health Record, your organisation's My Health Record security and access policy does not apply. True or false?
Still a few answers coming in.
Contemplating.
Okay, I'll end that now.
Thank you, Ellie.
And share.
Oh, look at that. Yes, 96% false. That is correct. It doesn't matter where the clue there was an access to, okay? So it doesn't matter where you're accessing it, then the policy definitely applies, okay? Thank you very much. Very good. All right, which leads me to the next page about remote access. So if you are a practice that has many, you might have a few GPs doing telehealth and they can't make it into the practice, the road's flooded, right? We need to keep seeing our patients, you activate telehealth for the day, then that means the GP is probably using their laptop to log in, secure network to log in. Then this is where the policy applies. So as part of your security measures, you should document any remote access that is enabled for staff who are able to use the clinical information software outside of the healthcare organisation. As you can see, the template includes a remote access section where you can list security measures in relation to remote devices used, for accessing My Health Record. So if your organisation, obviously, again, the same thing applies, being a template. If you do not have remote access functionality to access My Health Record, you can simply state that in the policy. All right, so that's enough on that. Like I said, there's a much deeper dive on every single page and every component of that. If you feel like that's worthy of a separate webinar, please let us know. We're more than happy to consider that. But on to chapter 2. This is following registration for My Health Records. So once you've developed a security and access policy, you will need to complete the following steps. So connect to My Health Record, and you can set that up via the conformance software or decide to go through the National Provider Portal on the web. Provide staff training and enable user account access. So you need to register your organisation for a HPIO, and with the My Health Record system. Now, the responsible officer of your organisation will need to register the organisation with the HI service to obtain a HPIO. To do this, you need to register for a provider digital access or PROTA account, link to HPOS, Health Professional Online Service, register a seed organisation with the Healthcare Identifiers service, and register any network organisation if that's applicable for you. Now, next, you need to obtain the HPIIs for all clinical staff who will be using the My Health Record. So all healthcare providers within your organisation will need to be uniquely identified using their HPII to access the system. All ARPA-registered healthcare providers will already have a HPII, so you only need to ask the staff and they should be able to provide it for you. Next, you'll need to set up access. In most healthcare settings, access to the system is via conformant clinical software, the National Provider Portal, or hospital applications if that applies to anyone. Okay, so Ellie, could you launch, I'm going to launch another quiz before we move on to the next section, if you wouldn't mind, please. This is a simple and quick one. So My Health Record training has to be accredited. True or false? Some might be pausing and thinking, is this a trick question?
Okay, I'll end that, Brenton.
I'm curious to see the responses on this one.
Yeah, it's very even actually.
Ah, isn't this interesting? Right, so drum roll. The answer is false. The 40% who clicked said false. Congratulations. But to those that said true, I don't blame you, because to be brutally honest, I actually said true when I first did this quiz. So there you go. But it's easy to think that way. But the agency, the ADHA, does provide a range of both CPD accredited and non-accredited training and resources to fit the training needs of your organization. So it doesn't have to be accredited, so long as you do the training and you record it. All right, pretty straightforward. But the idea is not to make it too hard, but to make it relatively easier and accessible. So staff training is not only a part of the policy, but a key component after registering. As an organization, you should develop, maintain, and review a staff training register. Up-to-date list including names and positions of staff authorized to access the My Health record. Providing training will help embed the use of My Health record in clinical workflows, e.g. health checklists, right? And build confidence in the use of the system. Now, there is a recommended training list that the agency publishes quite regularly. This is freely available on the website. Now, and it provides you with information on what would be important for your staff to learn about the My Health record system and links to appropriate training resources. Now, I want to emphasize this a little bit here, because the training, the e-learning modules are designed to give full training capabilities for the team, and especially for clinical users. There are specific demo environments that use dummy data, in which GPs, nurses can practice using My Health record in the context of the clinical information system that you use. Now, the reason why this is important is because you can't, in practice, train in the live environment looking at patient records. All right, it's recommended you do it in the training modules, so it's safe and secure, using dummy data, so that then once you've completed your training and you've been flagged as done so, you're then qualified to then apply that in clinical settings. Now, here's just a pretty bland, crude example of how you might record a training register. Pretty straightforward. There's no particular template on this. It's just an example of what you might employ. But the agency is aware of situations where a regulator requested an organisation to provide evidence of training. So it is strongly recommended that organisations include details within the policy of what training is provided and how it is maintained. And this can be communicated through something like this. As mentioned, training must be provided prior to My Health record first access, which can be listed on the register. Ongoing refresher training should also be provided and encouraged to maintain clinical confidence in dealing with the system. Also, if online training is being utilised, it would be recommended to retain copies of certificates of completion. Now, this is important. When individuals complete these modules via the agencies, the ADHA's learning management system, they are issued with a certificate which can be used, there's your proof, right, by your organisation as evidence of training. Now, I just want to emphasise the earlier point about refresher training. There are so many applications where this applies, right? Registrars, if they're starting every year, certain date. Planner is part of induction. It's a mandatory half a day activity in order for them to complete, right? Tick it off, get it done. Any new GP starting under contract, put it as part of induction planning, okay? This should be a mandatory requirements in the first few days, first week in starting with your practice. Now, once training is completed, it's important at this stage to ensure that any authorized staff have been given access in your software through the user preferences section. Now, this example is BP Premier, of course, and it'll be similar for Medical Director or Communicare or Genie and the like. So it's also important to find out how to deactivate or suspend access within your software as well. Now, if you need help, we obviously recommend you contact the software vendors, and they can support you or your IT department. But you have to make sure, okay, there should be a whole workflow documented that when staff leave the practice, there's a whole workflow to remove them from the system so they no longer have access. Okay, so on to chapter 3. We're going to explore the range of ongoing participation obligations required. Right? And a lot of it's going to be a repeating of what I've just been through already and stating the obvious here. But we're going to look at regular review of the security and access policy, as we said, annually, minimum. Review data quality procedures, user account management, provide refresher training to staff and for staff inductions, respond to any requests for assistance made by the operator, and comply with notifiable data breach requirements. So here we can see what an organisation needs to be aware of and act on. All right, this is a nice little diagram, circular flow, in which we review, maintain, enforce, and communicate the policies. Conduct ongoing user account management practices. Respond to requests for assistance made by the system operator. Exercising due care when reviewing or uploading documents to My Health Record. Notifying when errors or data breaches occur. Keeping the RO and OMO up to date. Providing My Health Record training to authorised staff. And there are many different situations when your organisation is required to review and update your policy. You will need to conduct a review and make changes when any material, new or changed risks are identified, such as a change within the system, organisational regulation, factors that may result in unauthorised access, use or disclosure of information in a record. So when else might you need to update it? Well, data breach in particular has occurred and risks have been identified. So when data breach has occurred, it may indicate that an organisation does not have sufficient measures in place to authorise staff access or in relation to the provision of training, and that needs to be addressed. Now, ongoing user account management includes measures like restricting access only those who require access as part of their duties, having a unique identification for each individual using it, having password and or other access mechanisms that are sufficiently secure and robust to ensure security and privacy risks associated with unauthorised access to the system are adequately covered. So don't share passwords, for example. Regularly reviewing passwords to ensure they are regularly changed and sufficiently complex. Implementing screensaver settings on computers so that users are required to enter their username and password to deactivate screensavers. It's annoying, I know, but again, these are simple things that can offer those layers of security. Ensuring that individuals no longer authorised to access the My Health Record via or on behalf of the healthcare provider organisation are not able to do so via their accounts, as we talked about previously, and suspending a user account that enables access. All right. Now, the My Health Record security and access policy template outlines strategies that you can use and act upon. The organisation will need to assist with any inquiry. Remember, it was in the legislation, right? In the rule. Review, assess, investigate, or complaint regarding My Health Record. An example of this would be when letters are sent out to organisations that have used the emergency access function and the organisation is requested to investigate. Another example is providing a copy of your organisation's My Health Record security and access policy to the system operator, if requested. Timeframes, may differ for different requests, but it's documented that it's always within 7 days. So an organisation that will be accessing and using the My Health Record will need to ensure that authorised staff are exercising due care when reviewing and uploading. First, by ensuring information being uploaded to the My Health Record is authorised by individuals that are registered healthcare providers who have a healthcare provider identifier, so HIPI. Now note the exception of advanced care planning information, which is authored by consumers and may be uploaded by healthcare providers on behalf of consumers. It is important to conduct regular checks to ensure staff with a HIPI using My Health Record have a registration that is not conditional, suspended, cancelled, or lapsed. 2, taking reasonable steps to ensure any information uploaded to My Health Record is easily understood, accurate, and up to date at the time it is uploaded. It's also important to ensure information is not defamatory or subject to copyright. You can see the OAIC guidance for additional information on the relevance of the Australian privacy principles when using My Health. I mean, there's a section there, for example, regarding scans and video files and things like that and copyright. Ensuring that data quality is maintained when information is uploaded to My Health record and that it complies with the relevant legislative obligations. This includes establishing and maintaining a list of individuals authorised to access the My Health record on behalf of your organisation and to ensure they are registered healthcare providers. And finally, having processes in place to prevent a clinical document being uploaded to the My Health record where an individual has asked that information is not uploaded. So those processes, so in other words, in your clinical information software, utilise the confidential flag as a good example. Now, part of the ongoing obligations is to notify the agency as the system operator and, where relevant, the OAIC as soon as practicable after becoming aware of a potential or actual data breach relating to My Health record. Now, if you need more information on managing a data breach, you can go to the agency's website, ADHA website, which describes the steps for notifying. It's actually quite a valuable resource. And I highly recommend you do so because, to be honest, to do this justice is a whole webinar in itself. But for example, if a healthcare provider system is infected with malicious software, this could compromise the system and may allow unauthorized access to the information in the system. Notice how I said may allow, right? The provider would need to notify the agency immediately and at the same time take steps to remove the malicious software from their system. Now, as a system operator, the ADHA need to take steps to ensure all of the information in the system is secure. Healthcare consumers must also be allowed to take steps to mitigate any risks to their data. Now, I often say to practice, think of the 4 basic steps, to managing breaches, and this is outlined in the ADHA website. But step 1, contain the situation. Step 2, assess the impact and the extent of the situation of that breach. Manage your notifications. 4, continue investigation. Just because it happens doesn't mean you do the initial investigation and you communicate, you can let it go. It's about continuous improvement, continuous investigation. Now, your organisation will also need to ensure the agency, as system operator, is notified within 2 business days of becoming aware of a non-clinical My Health record system related error in a record or of a material change to your organisation. Notify the system operator within 14 days if you cease to be eligible for registration with My Health record. For example, because you are closing your business or have ceased trading, no longer have a HIPPO for your organisation, or no longer employ a healthcare provider individual who has a healthcare provider identifier or HPII. So now remember these 3 basic rules for training. I can't emphasize the importance of training, all right? Before staff are authorized to access the system for the first time, right? So don't even let them go anywhere near that little green button, My Health record, until they first of all can prove to you they've been trained. 2, when any new authorized staff join your organization, as I said, introduce as part of induction programming, as a year refresher for those who have already completed the training. And this can help build their confidence in interacting with the system. There's no harm in refresher training. And of course, let's not forget, the RO and OMO should be regularly updated as well. And we're going to do that in Proda. So very quickly, I'm going to run you through the screen grabs. Most of you will be very familiar with this process. So I'll go through it relatively quickly. So you log in. This is to change the RO in particular. You need to enter your username and password. And of course, you'll utilize your 2-step verification, enter the code. Once you get to the Proda screen, you go to service. And this step will only appear if you're linked to the organization through both your individual and your organization Proda accounts, but select no organization, proceed as individual. So in the HPOS screen, you recognize My Programs, My Healthcare Identifiers, and My Health Record. And usually down the bottom, Healthcare Identifiers, Change Responsible Officer. Now note, if you can't see this tile, you may need to link your healthcare identifiers with your Proto account to get all of the HPOS tile options. If you remember, if I go back, click on link identifiers here to adjust all that. So then you'll come to, so before starting the Change Responsible Officer application, it's definitely a good idea to read the information at the top. Don't rush it, just to make sure you meet all of the eligibility requirements. So to start the application, just enter the HPIO or Healthcare Provider Identifier Organisation number of the organisation. And if you're unsure of this, you can tick the I do not know my HPIO number option. My recommendation, though, is to track it down. Again, go to HPOS and go to your organisation's details, and you'll find your HPIO number there. Get that first, and then fill out both fields with the asterisk with the HPIO and ABN. Apply now. So the Change Responsible Offer application form will appear. In the first tab, the current organisation's details should be displayed, so it should pre-fill. This is based on the details you provided, the current information that's returned from the ABR. So once you confirm this is correct, select Next. So in the RO tab, you can see now here, I'm just navigating from left to right here. So you can see we were on current organisation summary. We're now on the RO tab. It appears next to the details as responsible officer will be displayed. So if your Proto account is already linked to your HI service record, some of those details will pre-populate down here. Any additional details provided in this section will be used to update your existing record. Please take note of that. And as mentioned previously, the RO is also assigned as the organisation maintenance officer. So you start off being a dual role, and it can be assigned in the next section by clicking Next. You can use any of these identifiers to link your account, by the way. So responsible officer, organisation maintenance officer, HPI or HPO. Now, to register additional OMOs, tick the relevant checkbox and proceed to filling in the required information. The OMO can link their Proto account to the organisation's HI service record using HPOS. If the additional OMO is already registered in the HI service, you will need to provide details of their current HI service identifier. If you're only needing to add or remove the OMO and not the RO, you will need to do that through HPOS to make these changes instead. So you don't use this particular form to do that. Click Next. So in the final tab, just need to upload any documents as evidence that you have the authority to commit the business. This screen also includes a list of acceptable documentary evidence that you can provide. You will need to be listed as the addressee on the document. Now, it is very important. Again, think of the basics here. Okay, so there needs to be evidence that for your full name, Mr. Brian Jones, for example, that needs to be echoed on the documentation as well. So like examples of some of that documentation are contract for sale or purchase document, lease agreement or rates notice for the organisation's primary place of business, certificate of registration of a company issued by ASIC, most common one, notice issued by the registrar of the ABR containing the business entity's name and ABN, and document issued by the ATO with the organisation's name and tax file number attached. Now, some little curveballs here. If the legal structure is a trust, the organisation's appointment as a trustee needs to be noted. If your name is not listed on the document, you will need to provide additional documentation, such as affidavit or stat dec, a deed of appointment, or any other document that shows you have a position of authority. So click Submit once you're comfortable with that. And in the next stream, a confirmation of the application. Don't forget, or people forget, down the bottom left, you've got a little I agree once you have a good read of the privacy notice and declaration. And then if you're happy, press confirm. So once confirmed, a message will appear at the top of the screen to confirm the application submission. And you should receive the outcome of the application in your HPOS inbox. Now, that's important. People often think, why hasn't it come through my email on Outlook? That's because it will only be in your HPOS inbox. You have to remember, Proto, HPOS have their own mail inboxes, and they should be treated as separate. Okay, so to conclude this session, we have provided a list of useful resources. There's a ton. Now you can access the OAIC policy template, as I mentioned, for further support on developing a My Health Record security and access policy. You can reach out to the e-learning modules on the ADHA. There's also a link to access the My Health Records Rule 2016. If you've got some spare time, put your feet up, glass of vino. It's an exciting read, I'm sure. Staff training opportunities. And if you're a sole trader, and I'm not sure how some of these sections apply to you, there is additional guidance on the ADHA website to support you in those efforts as well. All right. I'll just leave that slide up there just for a little bit longer so you can see. And there's some more. This is mainly your training, your e-learning modules. So if you haven't checked this out, this should be a bookmark page in your web browser so that as part of your induction kit, staff know where to go from day one. And of course, don't be afraid to lean on the PHN. Lisa and I are more than happy to visit and support you and the team with some hands-on face-to-face training as well. Okay, so I understand we have some chats in the chats box. Ali, is that correct?
Brenton, there's one there from Ruth around from section 2 of your slides, and she's got, what about locum GP who are only there for 2 weeks? And that would have been with the training I think you were talking about.
Yep.
With
I mean,
Proto, yep. Okay.
Definitely applies. The clinical, if they're required to access, if they're a staff member that are required to provide care, clinical care, and part of that responsibility is to use My Health Record in the provision of that care, then they need to be inducted. They need to be trained. Yeah. Now it could be, this is quite common. It could be that they've, done training at another organisation and that they've registered that at another organisation, so they're up to date with that. Then just get them to provide evidence of that. But they need to make sure that they're aware of your policy. They're coming to work for your healthcare organisation, so they need to be inducted on that as well.
Okay, that's the only question. But if we've got time, people want to unmute and ask anything, that is fine. I still had one more poll though. Is that?
Certainly, yes. We could do the final. Let's do the final poll. Yes, okay. Let's do the final poll. Yep. Well, just for fun, we'll do one more final poll, and then of course I'm just going to leave the link to the survey as well here if you need to. So so this is a bit of a pop quiz after going through the presentation. So before an organisation implements a new way for their authorised staff to access the My Health Record system, e.g. remote access, the organisation will need to update their My Health Record security and access policy. This one's pretty straightforward. We should all get this one correct.
A few coming in, and there's another question after this too, Brenton.
Right.
So we'll do the poll first. Okay, I'll end that. And it looks like, there we go.
Yay, 100% correct. Look at that.
Right.
I think people were actually paying attention at lunchtime. Isn't that fantastic? Yeah, of course. All right, pretty straightforward.
Okay. Question here. With locum, should we then deactivate them when they leave? If they are returning locums, do we leave them on?
Yeah, so that's a very good question. If they're a regular rotation, then I guess there's no harm in leaving them on. It depends on that space between. I mean, effectively locums are using they're accessing My Health Record under other organisations. So long as their HIPAA is recorded under that organisation and they're accessing using that particular software, then they're compliant under that organisation. So it should be fine to leave them. Yep.
Okay, thank you.
They're treated a bit like any kind of casual staff member that comes in on a regular basis, and that's fine.
Okay, and that's all the questions, Brenton.
Great. So please don't be shy with the evaluation survey. It's your opportunity to tell us if there's something I may have missed. There's a lot to pack in this webinar, right? When I'm talking about policy and compliance, there's a lot. I tried to do my best to fit it within an hour. It looks like I just made it in time. However, I did feel like I had to fly through a lot of slides there. Please be honest, and we're more than happy to break this down into much more deeper dives in certain sections depending on where you're at, of course, with your My Health Record usage and adoption.
Thanks, Brenton. Thank you, everyone, for attending today.
Yes, thank you.
We'll just stay on in case there's any more questions, but people can feel free to leave. This is recorded and we'll put that on the website as soon as we can. We'll let you know. I'll also send out the evaluation link after today's session as well. Thank you for filling that in. Just a lot of thank yous coming in, Brenton and Lisa. That's nice. Okay, I'll end the meeting now.
Thank you all. Thanks, Ali.
Thank you. Thanks, Brenton. Thanks, Lisa.
Ciao.